I'm Dr. Kim Allen Williams, and I am the Chairman of Medicine at U of L Health. My interest in becoming a healthcare provider really had to do with growing up on the south side of Chicago, having a variety of illness, mostly because my mother was a smoker, and so I would get pulmonary this and pulmonary that. And then ending up recognizing fairly young that the medical care could be optimized. During a hospitalization, I recognized that with my pneumonia, because I'd had it 3 times before, that we really needed the antibiotics exactly on time and to make sure that I could get back to school, and it turns out it wasn't happening. I think that was the first time that I recognized that there are healthcare disparities and that there are places that do very well, high quality work, and there are places that don't. And we have to do everything we can to help all of them and the people who are affected by that. My role as a provider really is to try and get the patient to the next level of health and get them to maintain that or improve that. And the answer is lifestyle. It's diet, it's exercise, sleep. There are things that we can do to make ourselves healthier so that we're not a burden on ourselves, on our families, and our society. My approach to patient care really is to try and get everyone to recognize that the reason that they're in my office is something that they could control. I have a handful of patients who will say, "Doctor, just give me a pill so I can go back and do the things that maybe come to you in the first place." But most people are not like that. They really are genuinely interested in getting better. What makes the team here unique is that there's a dual focus that I was hoping to bring to the department, and I found it was actually here already. So it really resonates with what I would like to see happen. And that is a focus on health equity and a focus on prevention. And this is actually fairly unique. We actually have healthcare disparities that are very severe in this country. They're socioeconomically driven. We have some major issues with particularly cardiovascular health, but all forms of health. That concern that I find at U of L is at such a high level that we know that we're going to try to attack these problems and we're going to try to solve them. Outside of work, I mostly try to play tennis. Going back to my teenage years and getting to the University of Chicago and being the #1 singles player, and played some professional tennis. My career prize money is about $4,000. But British Medical Journal and actually a couple other journals saying 57% decrease in age-adjusted mortality if you're a tennis player. And so that only made it worse for me. So it have to deal with the chronic injuries. It does keep you fit, but it is, I think, the sport of a lifetime.